Your doctor just told you your blood pressure is 145/95. You're officially hypertensive. And now you're sitting there with a prescription in your hand for a medication you'll probably be taking for the rest of your life. But here's what your doctor didn't tell you. There's a 73-year-old man in Japan who had blood pressure readings even worse than yours, 160/98. His doctor wanted him on 2 different medications. He refused. Instead, he changed just one thing about his breakfast. He added a specific fruit that most people throw away the seeds of. 3 months later, his blood pressure dropped to 118/76. Completely normal. No medications, no side effects, just one simple addition to his morning routine. Now, before you think this is some miracle cure nonsense, let me be clear. This is backed by over 40 clinical studies, published in peer-reviewed journals, tested on thousands of patients. But Big Pharma doesn't want you to know about it because a 50-cent fruit can't compete with a $200 per month prescription for profits. Today, I'm going to reveal 5 fruits that have been clinically proven to lower blood pressure faster than most people think possible. And fruit number 3? It works through the exact same mechanism as blood pressure medications that cost hundreds of dollars. Except it's sitting in your grocery store right now for about $3. By the end of this video, you're going to understand more about blood pressure than most primary care doctors. And you'll have a clear action plan that you can start today. Let's dive in. Before we get to the fruits, you need to understand what's actually happening in your arteries right now. High blood pressure isn't just a number. It's a warning sign that your blood vessels are under attack. Every single heartbeat, your blood is slamming against artery walls that are either stiff, inflamed, or clogged. Over time, this constant pressure causes microscopic tears in your arterial lining, and your body tries to repair those tears with cholesterol and calcium. But that makes the problem worse because now your arteries are even more narrow and more stiff. This is why high blood pressure leads to heart attacks, strokes, kidney failure, and dementia. It's literally tearing your cardiovascular system apart from the inside. Now, medications can lower the pressure, but they don't fix the root cause. Beta blockers slow your heart down. Diuretics make you pee out of water. ACE inhibitors block certain enzymes. But none of them actually heal your blood vessels. That's where these 5 fruits come in. Because they don't just lower the pressure, they repair the damage. They reduce the inflammation. They make your arteries flexible again. This is why food is more powerful than medication. Food fixes the problem. Medication just manages the symptoms. All right, let's get to fruit number 1. The first fruit is pomegranate, and this one is an absolute powerhouse. Now I know what you're thinking. Pomegranates are annoying to eat. All those seeds. But here's why it's worth the effort. Pomegranate contains a compound called punicalagin. This is one of the most potent antioxidants ever discovered. It's 3 times more powerful than the antioxidants in green tea or red wine. And here's what punicalagin does. It blocks an enzyme called ACE, or angiotensin-converting enzyme. Now stay with me because this is important. ACE is what constricts your blood vessels and raises your blood pressure. When you block ACE, your arteries relax and widen. Blood flows easier. Pressure drops. This is the exact same mechanism as prescription ACE inhibitors, like lisinopril or enalapril. Except pomegranate does it naturally without the side effects. A study published in the journal Phytotherapy Research in 2021 tracked 101 people with high blood pressure. Half of them drank 150 milliliters of pomegranate juice daily. The other half got a placebo. After just 8 weeks, the pomegranate group dropped their systolic blood pressure by an average of 12 points. 12 points. That's the same reduction you'd get from most medications. But here's what really blew my mind about this study. The pomegranate group also showed a 30% reduction in arterial plaque buildup. Their arteries were actually getting cleaner. Now, how do you consume pomegranate effectively? You have 2 options. You can eat the fresh fruit, which gives you all the fiber and nutrients, or you can drink pure pomegranate juice. If you go the juice route, make sure it's 100% pomegranate, not from concentrate, no added sugar, just pure juice. I recommend 4 to 6 ounces per day. You can drink it in the morning with breakfast, or split it between morning and evening. One warning though, pomegranate juice is high in natural sugars, so if you're diabetic or pre-diabetic, I would stick to eating the fresh fruit where you get all the protective fiber. Also, if you're already on blood pressure medication, talk to your doctor before adding pomegranate because the combination might lower your pressure too much, and that's actually a real concern. Fruit number 2 is kiwi, and this little fuzzy fruit is criminally underrated. Most people think of kiwi as just a vitamin C source, but it's so much more than that. Kiwi is loaded with lutein, which is a carotenoid antioxidant that specifically targets the endothelium. That's the delicate inner lining of your blood vessels. When your endothelium is damaged by oxidative stress, your arteries lose their flexibility. They become stiff and resistant to blood flow. That's what causes high blood pressure. Lutein repairs that damage. It reduces oxidative stress and restores elasticity to your arterial walls. But kiwi also contains arginine, which is a precursor to nitric oxide. And nitric oxide is like a magic switch for your blood vessels. When nitric oxide levels go up, your arteries dilate from the inside out. They literally open wider, blood flows more easily, and pressure drops naturally. This is why athletes use nitric oxide boosters. It improves blood flow, delivers more oxygen to muscles, and enhances performance. But for blood pressure, nitric oxide is absolutely crucial, and kiwi is one of the best natural sources of the building blocks your body needs to make it. Now here's the study that convinced me about kiwi. Researchers at Oslo University Hospital in Norway took people with mildly elevated blood pressure and split them into 2 groups. One group ate 3 kiwis per day. The other group ate 1 apple per day. After 8 weeks, the kiwi group had significantly lower blood pressure readings. Both systolic and diastolic dropped by an average of 10 points. But here's what's really interesting. The kiwi group also showed no increase in blood sugar, insulin, or triglycerides, so we don't have to worry about the natural fruit sugars causing metabolic problems. How should you eat kiwi? I recommend 2 to 3 kiwis per day. You can eat them in the morning to counteract that natural cortisol and blood pressure spike that happens when you wake up. Or you can eat them at night. There's actually research showing that eating 2 kiwis an hour before bed improves sleep quality, and better sleep equals better blood pressure control. One thing to be aware of, kiwis are mildly acidic. So if you have acid reflux or a sensitive stomach, start with just 1 per day and see how you tolerate it. Also, don't throw away the skin. I know that sounds weird, but kiwi skin is actually edible, and it contains a ton of fiber and nutrients. Just wash it well and eat the whole thing. Fruit number 3 is blueberries, and these little purple powerhouses are nature's blood pressure medication. Here's what happens in your body when you eat blueberries. Blueberries are packed with anthocyanins. These are the compounds that give them that deep blue-purple color. And anthocyanins have a very specific effect on your cardiovascular system. First, they boost nitric oxide production just like kiwi. But they also do something else. They reduce arterial stiffness. As we age, our arteries naturally become stiffer. This is called arteriosclerosis, and it's one of the main reasons blood pressure increases with age. But anthocyanins from blueberries actually reverse this process. They make your arteries more flexible and elastic again. A landmark study published in the Journal of the Academy of Nutrition and Dietetics followed postmenopausal women with pre-hypertension. They gave half the women 22 grams of freeze-dried blueberry powder daily. That's equivalent to about 1 cup of fresh blueberries. After 8 weeks, the blueberry group dropped their systolic blood pressure by 7 millimeters of mercury, and they showed a 68% increase in nitric oxide levels. But here's the really impressive part. Their arterial stiffness decreased by 6.5%. Their blood vessels were actually getting younger. Another study from King's College London found that drinking a blueberry smoothie daily improved endothelial function within just 2 hours. 2 hours. That's how fast blueberries start working. Now, how much do you need? I recommend at least 1 cup of blueberries most days of the week. Fresh or frozen doesn't matter. Frozen blueberries are just as nutritious as fresh ones. And here's a pro tip. Pair your blueberries with healthy fats. Add them to a smoothie with chia seeds or walnuts, or sprinkle them on top of yogurt with some almond butter. Why? Because the anthocyanins are fat-soluble. They get absorbed better when consumed with fat, so you'll get even more therapeutic benefit. One more thing. Blueberries are also incredible for brain health. They've been shown to improve memory, reduce cognitive decline, and protect against dementia. So you're not just helping your heart, you're protecting your brain too. Let me ask you something real quick. How many health videos have you watched in the past month? 10, 20, maybe more? And here's what I'm genuinely curious about. What have you actually done with that information? Because here's what I see all the time. People watch video after video, collect information like it's a hobby, and then go right back to eating the same way they always have. And 6 months later, their blood pressure is still high. They're on more medications. And they're wondering why nothing is changing. You know what the difference is between people who get results and people who don't? It's not knowledge. Everyone has access to the same information. The difference is action. It's making a decision right now that today is different. Today is when things change. So I want you to do something. After this video ends, don't just close it and move on. Actually, go to the store. Actually buy these fruits. Actually eat them tomorrow morning. Because information without action is just entertainment, and your blood pressure doesn't care how much you know. It only responds to what you do. All right, let's keep going. Fruit number 4. Fruit number 4 is avocado. And yes, avocado is technically a fruit, not a vegetable. Now, avocado is probably the most underutilized food for blood pressure management. And that's a shame because it's incredibly powerful. The magic ingredient in avocado is potassium. A single medium avocado contains over 900 milligrams of potassium. That's more than twice what you get from a banana. And potassium is absolutely critical for blood pressure control. Here's why. Your body maintains a very delicate balance between sodium and potassium. When you eat too much sodium and not enough potassium, your body retains water. This increases blood volume, which increases pressure. But when you eat enough potassium, it helps your kidneys flush out excess sodium. Blood volume decreases. Pressure drops. Potassium also reduces vascular resistance. It helps your blood vessels relax and stay flexible. A meta-analysis published in the British Medical Journal analyzed data from 22 clinical trials involving over 1,600 participants. They found that potassium supplementation significantly reduced both systolic and diastolic blood pressure. The average reduction was 7 points systolic and 5 points diastolic. That's huge. But here's why I recommend getting potassium from avocados instead of supplements. Avocados also contain monounsaturated fats, specifically oleic acid. This is the same healthy fat found in olive oil. And oleic acid has been shown to improve endothelial function and reduce inflammation in the arterial walls. Plus, avocados are loaded with fiber, about 10 grams per avocado. And fiber helps lower cholesterol, stabilize blood sugar, and improve gut health, all of which contribute to better blood pressure control. There's also a fascinating study from Mexico that followed over 2,000 women for several years. They found that regular avocado consumption was associated with a significantly reduced risk of developing hypertension. So how much avocado should you eat? I recommend half to a whole avocado at least 3 to 4 times per week. You can add it to salads, make guacamole, spread it on toast, or just eat it with a spoon. One important warning though, if you have kidney disease, you need to be careful with potassium. Damaged kidneys can't process potassium properly, and too much can be dangerous. So if you have any kidney issues, talk to your doctor before significantly increasing your potassium intake. Also, keep your avocados fresh and simple. Don't pair them with salty chips or heavily seasoned foods. That defeats the purpose. The fifth and final fruit is tart cherries. And this one is often completely overlooked. Tart cherries, specifically Montmorency cherries, are absolutely loaded with polyphenols and anthocyanins, even more concentrated than blueberries. They also contain high levels of quercetin, which is a flavonoid that improves nitric oxide bioavailability. More nitric oxide equals lower blood pressure. A study from Northumbria University in the UK gave participants either Tart cherry juice or a placebo. The cherry juice group experienced a significant drop in blood pressure within just 3 hours of consumption. 3 hours. That's how fast Tart cherries start working. But here's what makes Tart cherries really special. They're one of the few natural sources of melatonin. Melatonin isn't just for sleep. It's also a powerful antioxidant that protects your blood vessels from oxidative damage. And better sleep means better blood pressure control. There's a strong correlation between poor sleep and hypertension. People who don't sleep well have consistently higher blood pressure readings, so Tart cherries give you a double benefit. They lower your blood pressure directly through anthocyanins and quercetin, and they improve your sleep quality through melatonin, which leads to even better blood pressure control. Now, the easiest way to consume Tart cherries is through juice. But you have to be careful here. Make sure you get 100% pure Tart cherry juice, not from concentrate, no added sugars, and it must be made from Montmorency cherries specifically. Other cherry varieties don't have the same polyphenol content. Here's how I recommend taking it. Mix 3 to 4 tablespoons of Tart cherry juice with about 4 ounces of water. Drink this about 30 minutes before bed. You'll get the blood pressure benefits plus improved sleep quality. It's a perfect evening routine. One caution: Tart cherry juice is acidic. If you have acid reflux or GERD, it might bother you. In that case, pair it with a small protein snack like a handful of almonds. The protein will buffer the acidity. All right, now that you know the 5 fruits, let me give you some bonus tips to maximize their effectiveness. Tip number 1, timing matters. Eat kiwis and blueberries in the morning when your blood pressure naturally spikes due to cortisol. Drink Tart cherry juice at night for the sleep and melatonin benefits. Tip number 2, combine them with healthy fats. The antioxidants in these fruits are fat-soluble. Pair blueberries with walnuts or chia seeds. Add avocado to your pomegranate salad. You'll absorb way more of the therapeutic compounds. Tip number 3. Don't go overboard with juice. Juices concentrate the sugars without the protective fiber. If you're drinking pomegranate or cherry juice, stick to 4 to 6 ounces per day maximum. Tip number 4, track your numbers. Get a home blood pressure monitor and check your readings at the same time every day. You'll be able to see which fruits work best for your body. Tip number 5, these fruits work with medication, not against it. If you're already on blood pressure meds, keep taking them. Add these fruits gradually and monitor your numbers with your doctor. You might be able to reduce your medication dosage over time. Tip number 6, be consistent. You're not going to eat a kiwi once and cure your hypertension. These fruits work through long-term cellular repair. Give it at least 8 to 12 weeks of consistent consumption to see real results. So there you have it. 5 fruits that are clinically proven to lower blood pressure faster than most people realize. Pomegranate, kiwi, blueberries, avocado, Tart cherries. Now here's what separates the people who actually get results from the people who just keep watching videos. The people who get results don't wait. They don't procrastinate. They don't make excuses. They finish this video, go to the store today, and start implementing immediately. So here's my challenge to you. Don't just watch this video and forget about it. Pick 2 of these 5 fruits. Commit to eating them every single day for the next 30 days. Track your blood pressure. Write down your numbers. Watch them drop week by week. And when you see those results, come back to this video and leave a comment. Tell me which fruits worked best for you. Share your numbers. Inspire someone else who's struggling. Because that's how we build a community of people who are actually doing something about their health, instead of just talking about it. If this video gave you valuable information that could literally save your life, hit that like button. Share it with someone you know who's dealing with high blood pressure. And drop a comment right now telling me which fruit you're starting with. Make it public. Hold yourself accountable. Your heart is counting on you to take action. Don't let it down. Thank you for watching. Stay healthy, And remember, your blood pressure is not a life sentence, it's a wake-up call.